You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Welcome, Laura.
Hey, Polly. Thanks for having me.
Thanks for being on the podcast. Today I wanted to talk about urinary tract infections. How do you know if your dog has a urinary tract infection?
Okay, so most common symptoms of urinary tract infections in dogs, boys or girls are seem to be more prevalent, is increased frequency of urination, meaning they got to go a lot more often than usual. So that then translates to sometimes they're having accidents in the house, can't hold it overnight, getting you up to go out more frequently. And then when you witness them go to the bathroom, they posture in the position to pee and they stay there for a really long time, like way longer than usual, because they're probably at the end, once they get all the urine out, they're still feeling like there's more urine to come out. So they sit there and strain. Now, you might not physically see them strain, but they're sitting there for a really long time and they're thinking they got more pee to get out and they don't. So then they'll sometimes stand up, walk a couple steps and repeat, try again, reposture, like they feel like there's more pee in there and they need to go again. So that's hard to tell the difference in sometimes marking behavior, because dogs mark their territory, so people take their dogs on a walk, and girl dogs mark just as much as boy dogs. But if your dog's normally doing that and walking along and lifting his leg every tree, that's normal. But if all of a sudden your dog never did that, is starting to posture to urinate real frequently and get up and walk a couple steps and try again, then that means something's not feeling right.
Okay.
The other thing that, especially you guys in Colorado, well, we did see this in Illinois too. I will say we diagnose more urinary tract infections in the winter. Why do you think that is?
Because they're not drinking?
Nope, because when they pee in the snow, people can see that their urine's not right, and they can actually see blood in the urine.
Oh.
Yeah, so bloody urine is a sign of a urinary tract infection or some other problem with their urinary tract and needs attention.
And so is it usually just pills like humans?
Yeah, so most common reason for urinary tract infection, especially in girl dogs, is a bacterial infection, because the bacteria from their stool, from their feces, drops down out of their bum past their girl parts. And so that bacteria can work its way into the girl's urinary tract. That doesn't happen in boy dogs, but so bacterial infections would be treated with an antibiotic. The other reason dogs get bladder problems is bladder stones. So dogs get bladder stones more commonly. People get kidney stones. Kidney stones, when they pass, anybody who's ever had that experience, is extremely excruciating, painful. But dogs, they don't start in their kidneys. They usually start in their bladder. And they usually start there because of potentially chronic infections or breed predisposition and diet connections. And then the third reason for bloody urine and symptoms that mimic a bacterial urinary tract infection are bladder tumors.
Oh, okay. Okay.
So that's going to be usually an older dog, boy or girl, blood in their urine, straining to pee, usually blood at the end of urination. Boy dogs that are not neutered are more prone to prostate problems. And so prostate problems can look like a bladder infection as well. Frequency, straining, blood, dripping urine for boy dogs.
So I know because we've had urinary tract and the dogs have had to go on a certain diet for a period of time. Yeah.
Right.
Okay.
Yeah. So certain dogs are predisposed to certain kinds of bladder stones, and that diet's connected to that. I think that's true in people with kidney stones. Like if you are prone to kidney stones, you tend to not drink enough water and eat the wrong kinds of food. So you have to kind of watch your diet to prevent that from happening.
Okay. Okay. And so obviously no cranberry juice, like don't try to handle this on your own.
Yeah, technically that's a good question. There is actually a cranberry supplement for dogs, but that's only effective in dogs that have been diagnosed with a specific bacterial urinary tract infection. So the cranberry works for dogs that get chronic reoccurring E. coli bacterial urinary tract infections as a preventative. As a preventative, it doesn't treat one. So you have to get it treated first and figure out what it is, and then you can try and prevent that for the future.
And I would imagine it's harder to figure out if a boy dog has a UTI just due to the fact that they're always going to the bathroom.
They mark a lot, and yes, it sometimes can. But that's why if you see blood in the urine, if they're marking, if they're regular markers, then you probably won't notice. But if they're out in their backyard where they don't normally mark, and they're in the position they're trying to mark, but there's nothing to mark and there's no reason to be marking, that's a red flag.
Okay.
And so then the second part, just to help all the veterinarians out there, the way we find that out is we do a urinalysis. So that means we need a urine sample to diagnose a urinary tract infection. So when you take your dog to the vet, do not let him him or her pee in the parking lot before he goes in the vet.
Okay.
We need the sample. So they have to have, a bladder has to have some urine in it.
Okay. Okay.
And sometimes people will bring me, owners are very good at catching urine, especially if they have experience. But sometimes your vet will say, please bring a urine sample with you, especially if your dog's too anxious to pee at the vet. Or we have other ways of getting urine without making them, doing a free catch. But we can't get a urine sample if there's no urine to be had at the time.
Okay, sure.
So we catheterize boy dogs to get urine. We do a process called a cystocentesis, where when the bladder's full, we can see the bladder with the ultrasound and we put a needle in it and take the sample. That's a sterile technique. And then with that sample, we can culture it and find out what bacteria there is in there.
Okay.
We don't do that every time, but sometimes if owners can't catch a urine or the dog's too scared for us to squat and pee and let us stick we usually have the way to catch a urine sample is to take for a girl dog that squats low to the ground, take a pie dish, something kind of low-sided, and slide it under when she squats. Boy dogs are up off the ground. They're not quite as low. It's a little easier. Can put a little Tupperware container or something in there under there and just catch the sample and put it in a clean jar and bring it in. Has to be brought in pretty quick. Can't do it from the night before. Has to be a pretty fresh sample.
Okay. All right. Yeah. So that's interesting. Okay. Well, great. All right. Well, thank you for being on the podcast, and we look forward to having you back.
Thank you. You're welcome. Any questions come up, just let me know.
I will. Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.